guys, my name's Heather. I'm a hygienist here with GuruNanda, and today I'm going to teach you guys how to take care of your teeth when you have braces. Super important to make sure your hygiene routine is up to par when you have braces, because what can happen is when you get the braces taken off, white squares can be on the teeth. How does that happen? So when we're not taking great care of the teeth, when the braces are on, the bacteria sits along the bracket, and when that bacteria just sits there, it spits acid onto the teeth, wears away the enamel, and that's how the white spot occurs. So it's a breakdown of the enamel. It's called decalcification, and it's very common for people who have braces to get decalcification, but it's preventable. As long as you're taking really good care of the teeth, you will not get any decalcification. So the first tool I always recommend is using an electric toothbrush. They are just superior to using a manual toothbrush. They're far more effective, so I always recommend using an electric toothbrush. Now, more importantly than brushing, I feel, is flossing, because a lot of bacteria likes to hide in nooks and crannies that the toothbrush doesn't get into. So let's go over a couple different ways to floss your teeth when you have braces. So the best way is to take a piece of floss, thread it through each tooth, hug the tooth up and down, other side up and down, and that alleviates all the bacteria that sits in between the teeth. But you have to thread it through each and every one of the teeth, and I find that's very tedious. Patients aren't super compliant with it, so I like to recommend something called an interdental brush. So this brush right here, let me show you guys. It is a little toothbrush for in between your teeth. This is an effective way to help clean the bacteria that sit in between the teeth. You can also bend the tip so that it's super easy to use, and you're able to get all the way back in the back teeth with ease. Now, if you don't like to use these little brushes, they also have ones with a rubber tip. Each will work effectively. I just prefer the one with the bristles. I feel like it disrupts more plaque when the rubber one tends to just move the plaque around. Now, these are awesome options, but an even better option is a water flosser. Water flossers are absolutely amazing. They're actually called oral irrigators because they irrigate water underneath the gums, and in this case, around the bracket. So it's a super easy way to clean in between your teeth. All you're gonna do is do little U-shapes around the gums, and it'll alleviate all the bacteria that sits underneath the gums and around the brackets within seconds. So super important to take care of your teeth when you have braces. Stay consistent. Get your teeth cleaned every 6 months or every 3 months, ideally, when you have braces, and you will not get any decalcification. That's it for today's video. I'll catch you guys in the next one. Bye.